I am Dr. Ramy Habib. I'm a board-certified periodontist practicing in Northern Virginia.
My name is Mark Choi. I am the owner of Infinia Dental Lab. We do a lot of all-on-4 and huge full mouth cases and utilizing, new technology. And we have a lot of experience in that digital workflow. So today we're gonna have just a casual, discussion on all-on-4, and I'm gonna ask a few questions regarding it because you're a doctor, and I'm pretty sure you've gone through a lot of these procedures for all-on-4s.
We do a lot of these.
Yep, a lot of those. So I'm gonna first ask you, the first question here, I believe a lot of patients might have this question the most, is when is it time to start over? Like, do you wanna
So there are a lot of
that? Yeah.
answers to that. So if you're feeling yourself not chewing your food well, if you feel embarrassed of your smile, if you feel you have some loose teeth and that's not comfortable for you, I think now it's the time.
So how many teeth does it take until, is this the time to do an all-on-4? Or for those of you that don't know what all-on-4 is basically we place 4 implants in your bone, and then we will replace all of your teeth. So, okay, we have maybe one that's not in good condition, one tooth. Like, how many does it take? And even if you have a few of them left over, like, what is the best time to even extract those right now? Actually, even my mother-in-law right now has a few teeth right now, and some doctors are kind of scratching their head, should we take this out or not? Even doctors are sometimes, asking the questions to themselves. So when is a good time for the patient?
So every case is different. So there is no one solution that can fit everyone.
Yes.
So of course it depends on the bone support of these teeth. If I left those teeth longer, would I have enough bone to place implants? So there are so many factors. Gum disease. Is the patient have gum disease? Like, is it stable? Is it progressing? So of course every case is different. So if you feel even a single tooth is moving, it's time to see your doctor, and then you will have the discussion with your doctor on that and see what's the best treatment plan that suits you.
Okay, so even if one tooth is moving, you want the patient to come in and take a look at that.
Of course, because it's moving for a reason.
Okay.
So if it's, I understand if it's a trauma, like you fell down and you hit a tooth and it's moving, that's totally different than you're just like feeling that one tooth is moving more than the others. If I checked clinically, most likely I will find more teeth that are moving or will catch periodontal disease. Periodontal disease is a silent killer.
Okay.
You don't have pain with that.
Yeah. So that's what you mean. You mean if you have some kind of trauma or you hit your tooth and it's moving, yes, that makes sense. We'll need to replace that tooth. But without having any trauma and you have one tooth moving, it could be a progressive disease that you don't know
Exactly.
of, and it could be other things going on beneath there.
Yes.
And that's a reason for you to come in. And if we do find that, most of the teeth are,
in
failing,
bad condition, that might be the good time.
That's a good time to kind of do an all-on-4 case. Right? What if we had like 3 good teeth though? Or we have like progressive disease, but we have 3 good teeth. Should we keep those 3 teeth?
You have 3 good teeth?
Yeah.
It depends on where they are. Are they gonna like complicate the treatment? Are they in a good position, good aesthetics? So sometimes we can take out good teeth, like 2-3 teeth that are in the arch that is not gonna do you any good. Just by keeping them will make the aesthetics way worse. Then actually I can manage the spacing. Maybe they are good teeth, but not in the right position.
Okay.
So sometimes we have to sacrifice good teeth to actually give the best option for the patient.
And as a dental technician, you've made a lot of partial dentures. And sometimes you can make a partial denture for those 3 remaining teeth. Is number 1, partial denture is going to move around. Number 2 is that it could kind of hook off your remaining teeth, and over time your bite force is going to create load on those 3 teeth, and those 3 teeth will eventually fail down the road. So that's what I've seen, and I don't know if you've seen that before.
Definitely seen that. We see a lot of mobility around the clasps that hook to the teeth to give you some retention for your partial denture. And the other big concern is with bone, if you don't use it, you lose it. So without the stimulation of your roots of the teeth or from the implant itself, when you start chewing, the bone starts to resorb. Your jawbone itself starts to regress.
Okay.
So that's my biggest concern with partial dentures.
Okay. So right now, just to give you a little bit of my mother-in-law's teeth right now, she has 4 teeth left. Like, she has 6 implants, 4 teeth left, and it's a crown and bridge. And one of the 4 teeth are halfway into the bone. The other canines are exposed on the facial. Like, I'm thinking maybe it might be best to just extract those and just place a whole bridge. But what is your thoughts on that?
If it's a front area and she has all the implants in the back, I think it might be a good time to plan an all-on-X.
Got it. All right. Yeah, I'm thinking, most of you might have questions on, when is a good time to start. So I'm hoping that, these answers, answers your questions that you have on that, right? So the next question is starting point, the denture dilemma, right? Now, you have to get everything done, right? And the doctor, like Dr. Habib, might say, okay, we need to do an all-on-4 and all-on-X. But some of you might think that, okay, why can't we just do dentures, right? What is it with dentures? There can be cons and pros to it. So, like, a lot of people out there are wondering, should they just stick with dentures if they already have dentures? Or if they have teeth, should they extract them and get dentures? What is your thoughts on that? Yeah.
So if a patient has a denture and he's comfortable with, and he doesn't have any complaints, which is rare, but they can go on and have another denture. Okay. The worst case scenario is transforming somebody from a fixed solution, like someone has teeth, yes, they are failing, but he still have a bridge, he can still chew to some degree, and then move them to a plastic denture. That would be the biggest transition for the patient.
Okay.
That's why when I do all-on-X cases, we try as much as possible to even temporize with a fixed solution. Okay. So even the patient will leave the office with something that's sticking to the implants, that doesn't move, he doesn't have to take out, or she doesn't have to take out. Sometimes, yes, we can't, and we have to go with the denture solution as a temporary, but just transforming someone from a fixed solution to a removable is a big change.
Yes.
That wraps up part 1. Stay tuned for part 2, where we dive into dentures and snap-on dentures. See you there.